Hospital visits are rarely made under ideal circumstances. Aside from the planned treatment itself, there are so many other stress factors, including where to park, how to find the right place, and whether you'll arrive on time. The last thing a hospital wants to do is add to an already stressful situation. But with the complexity of how large healthcare campuses are built, it's almost inevitable. Buildings and wings that look the same and confusing signage means that even hospital staff have trouble finding their way around, let alone accounting for broken down lifts and wards being renovated. For patients, getting lost increases their frustrations and often results in running late for appointments. The fast-paced nature of medical jobs means that staff are always busy, yet patients and visitors struggling to find their way frequently resort to asking for directions from nurses, doctors and other staff. These interruptions delay staff when they should be treating patients. One of the most frustrating inefficiencies in hospitals occurs when patients arrive late or miss appointments altogether. Costly specialist equipment time can be wasted, while administration staff time is taken up with rescheduling and juggling time slots. Other patients are inevitably affected by longer waiting times, adding to their stress and frustration. Navigating their way within the hospital environment can be challenging for staff as well. Student nurses, temporary agency staff and visiting specialists could all benefit from finding their way easily around the hospital and having quick access to information about the facility and services.
Hospitals are highly complex environments for doctors, nurses, staff, patients, and of course their family and friends. At the time of need, we need to deliver patient care to the folks who matter the most, the patients. Their needs are highlighted in the business challenges that we just listed. But there's the other face of the coin. IT needs to pick these business challenges up and meet them head on with end-to-end solutions that meet the challenge of limited budgets in healthcare organizations from an IT perspective, and also deliver that solution in such a way that it's manageable.
A health IT strategy that includes public-facing mobile applications, like Aruba's Wayfinding solution, is critical. The ever-increasing number of patients and visitors carrying smartphones gives healthcare facilities an opportunity to truly engage with them and reduce frustration.
There are a lot of opportunities for all the stakeholders involved. Doctors and nurses, for example. They have an opportunity to discover each other on the go. They can discover where their patients are so they can reduce time to care. And patients themselves and their family and friends, they can easily start interacting with their caretakers outside the hospital, but also within the hospital. They can easily discover services like where the pharmacy is or where my next appointment is. These type of interactions will mean lots of data. And back office users, line of business leaders can look at that data and say, yes, that's where we really should focus on. That's where we really should focus on improving our process. And as we evolve the project, as we improve what we're doing, you can be sure there will be a lot of data and there will be a lot of process improvements to look upon in the future.
When we customize Wayfinder app to meet your environment, we start off by analyzing the real-world challenges you have. We do a day-in-the-life study. We'll follow a nurse around, a clinician. We'll pair up with patients and with visitors to understand what challenges they have, what stress points and pain points they have with their hospital, and where we can match up our technology solutions and our application to provide real-world value and make their stay or their visit or their workday more enjoyable and more efficient.
Aruba's Wayfinding solution is designed to make navigating complex hospital environments easy. Accustomed to mobile application tools such as Google Maps, visitors want to know where they are and where they need to get to in the shortest amount of time. An app that leads them on a direct path to the destination they're trying to get to without having to indicate a starting point. Aruba's Wayfinding solution can also be used to push notifications based on a visitor's real-time location. For example, a message near the waiting room could be sent when your script is ready for collection from the pharmacy. The app can also register when a patient arrives on site, so that staff know that they're on their way. It can push messages to the user, letting them know anything from appointment times to information about the specialist the patient is seeing, the procedure they're undertaking, or even the specials at the coffee shop. Aruba's Wayfinding solution overwhelmingly improves the use of hospital resources. By helping patients find the right location on time, it helps scheduling run more smoothly. Ultimately, fewer appointments are missed or delayed, so the use of hospital resources are maximised and unnecessary costs are avoided. It's well acknowledged that visitors are an important part of the patient recovery, and Aruba's Wayfinding solution helps families and friends to find the right ward so they can spend less time wandering the hallways and more time with the patient. When visiting is over, finding the way back to the car park is a breeze.
With CDM, we're looking forward to solving some of these challenges that healthcare organizations face, and maybe look for opportunities to have these organizations jump on the digital transformation efforts. CDM not only provides IT infrastructure delivery and support, but also has the highly skilled, trained professionals to deliver these digital transformation efforts that healthcare organizations need today.
CDM and Aruba Hewlett-Packard have been working together for almost 2 decades, building mobility solutions based on solving real-world problems. We have a unique blend of an application development team and a mobility networking team that, when combined, produces solutions that fit today's challenges and meet what businesses and end users are looking for.
As the growth in population and changing lifestyles drive higher demand for healthcare, hospitals are under increasing pressure to stretch budgets and keep pace. This means that increasing efficiency is vital. As a proven Australian IT provider, CDM delivers technology that provides solutions and improves customers' lives. We can help hospitals, universities, government agencies and business implement Aruba's wayfinding solution that will transform their everyday activities.